Welcome to the Operatory podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. I'm Dr. Bryan Laskin, and with me today is the man providing once again the patient perspective. Thanks for being here, Mr. David Pryor.
You're welcome, Dr. Laskin. How are you doing?
I am doing well. It's we have had an unseasonably warmish winter in Minnesota, which has been it's been amazing.
Well, yeah, I was driving past Lake Minnetonka this morning. I'm like, it is not frozen yet.
It's amazing.
It's awesome.
Yes, we're dating the podcast to be the end of 2020, and there's no real snow on the ground right now in Minnesota, and it's making it bearable. It's beautiful. It's amazing. Yes.
Yes, it is awesome.
Yeah, and one of the things this podcast, I really wanted to drive home something which dentists are looking for, particularly right now post-COVID. It's not post-COVID, actually. It's peaked right now, but the hopefully peaked. But a lot of practices have been really busy, but also profitability has been really crushed. And so I wanted to talk directly what we're seeing at Opera DDS, how people are driving a lot of high-value cases. So first of all, I want to kind of mention. Well, I'll talk about a specific patient that I like to talk about because his story kind of drives home how we bring in high value patients as an my office, but as an industry. Joe was the typical patient that needs to have a full mouth reconstruction or all on four type treatment who had gone for over 25 years without getting his teeth fixed. And he, like pretty much anybody who hasn't gone, I mean, let's face it, anybody who needs to have a full mouth reconstruction that needs to have all on four treatments, they don't need me to tell them that there's problems with their mouth, right? Yeah. They have a mirror, right? They've got other people around them that are, hey, Joe, what's going on with that thing under your nose, right? So they don't need me to tell them that he has large dental needs. So, large cases, Dr. Paul Homley, he's a wonderful dentist who talks about case acceptance. And I remember him talking about large cases and how they're different than every other case. Small, medium cases, if somebody needs to have a couple fillings, crowns, then it's sort of like, do they value the dentistry? But when it comes to a large case, it's very different. People typically don't be educated into going forward, right? Joe didn't need me to tell him, boy, your mouth is messed up. There's benefits to fixing it. Right?
Yeah.
And so what crosses people who have these types of unfortunate situations into them actually doing treatment is a life event typically. And it can be any type of life event. They can be getting married, they can be getting divorced, maybe they inherited some money and they thought they weren't worth it, and then they got this money and they're like, yay, now I'm worth it. Maybe they lost a bunch of weight. Whatever it is, there's a life event that makes them go, now's the time. Mm-hmm. And in Joe's case, it was his daughter was getting married, and he didn't want to look like he looked in his daughter's wedding photos and embarrass her. Every dentist has heard this. Like, my granddaughter said to me, my tooth is brown, so I want it fixed. Like, that's a life event. Even on one tooth, it can be, but typically speaking, for large cases like this, it's more challenging because, people feel a lot of shame. They don't know where to begin, and they feel, frankly, like they're going to be lectured when they come into the dental practice, right? And so what is our job as dental professionals to help these people? I believe it is to, communicate to people, your existing patients, because this includes your existing patients, right? That you do this type of treatment, that it's available, and that you can help them when they are ready. And then externally, and this is how you bring in these large cases, you make it easy for people to take that first step into your practice. And we've been doing that for a few years with teledentistry, with virtual consults, where we have it on your website via widget, a button, or just you can send to people a way for them to send you photos and video of their mouth, and we walk people through this process, and then you can reach out to them and say, hey Joe, thanks for sending in your information. We see people like you all the time, right? You aren't out of the norm. Which is true. We see people like you all the time. Come on in. We'll take some X-rays. There'll be, if you want to do it for no charge, or if you would or it'll be $150. So that's all. Whatever. But what I can tell you is that there's lots of things we can do for you. We'll give you a bunch of options, and then you can decide what, if anything, you want to do. And don't worry, we see people like you all the time. There's no lectures, no judgment. We just want to give you your options, right, and help you to get to a better place. And what we've seen a lot of success with people who are making it easy for patients to submit their photos and video via virtual consultations. And so, how does, from the patient's perspective, does that all ring true? And any suggestions you have for dental professionals to help these patients out?
I think you're right on with what stops them from walking in the door. So you've got somebody that's had 20 years of neglect, right? So just like you said, Joe's aware that he's got teeth problems, and he's aware that he should have been coming in. He's aware they should have been flossing more, brushing more. He's aware of all these things. So shaming does the opposite of what you want it to do, right? And so,
but
it's gratifying, I guess.
Yeah. Well, you feel like you're helping people sometimes, right? Because it's like, maybe if I shame them enough into action, right? But I agree with you. I don't think it's not productive.
No, it's not. And patients want you to be on their side, and when you're selling something and you're selling dentistry, you want to be on the same side of the table as your customer. You're going in this together to solve a problem, and that is certainly the perspective that I think that dentists should be. And I think for the most part, when I talk to dentists, that's really the perspective that they get on, like, hey, we're in this together, buddy. And sometimes people may lose their way. Like, you forget that day in and day out of telling people over and over, brush and floss, and then you get somebody that's been neglecting their teeth for 20 years. You're like, where do I start, right? And that, I think that's the point of what you're trying to get through here is, how does that patient start? Where do they? What's a trigger that you said there's a life event, so how do you as a dentist capture those opportunities when a patient does call in and say, I haven't been to the dentist 20 years, I've really got some things wrong with my teeth, but I want to make sure it's going to be a comfortable experience. It's kind of how that conversation goes, I would imagine.
Yeah.
So then it's on you. It's on that front desk. I mean, that front desk is probably the first engagement that they're going to have, that patient's going to have. So if they can create a positive experience for that patient, that's, I think, what's probably going to get them to overcome that fear and walk through your front door. I've certainly talked to tons of offices. I'm sure everybody listening knows of patients that start tearing up before their butt hits the dental chair, right?
Oh, yeah.
And so you guys always have your work cut out for you. So having a game plan on how to handle those big cases and knowing the step-by-step that you're going to do to get this patient from the safety and comfort of their home into the dental chair, that's what you... I imagine where you're going with this is, here are the steps to get that patient into the office.
Oh, yeah. It just helps people because I think patients want just to be reassured that they're not going to be judged and that they're not going to be forced and shamed. And they don't know that because they haven't been to the dentist in 25 years, right? Yep. And so, giving them the ability to reach out to you, and then you, frankly, can look at these photos ahead of time.
Yeah.
And too many options leads to no action, right?
Right.
And so that's been proven.
Yeah. That's 100% accurate.
And so you can look at you get your first. So when you walk in and you're talking to the patient, you'll be prepared, and you won't look like you're overwhelmed with what to do, because you'll have at least a semblance of where you're going to be headed with the case, which any dentist looking at some photos can go. Obviously you don't have periodontal probings and all the information you need to have, but you'll have a hell of a lot of information that you didn't have beforehand, right? If the patient just walked in. And it's really makes it easy for patients to come in. And what's been, during COVID, what we're really talking about is extending your practice beyond the walls of your practice and the hours. This isn't 9 to 5, Monday through Thursday. Come to my practice. It's if that patient is at home and they're sobbing and they go online, they see your website, they pop up their widget that says, how can we help you? Oh, I want to improve my smile. Oh, snap some photos with your phone. Right there at that moment in time, you struck while the iron was hot. You didn't take your receptionist away from talking to the patient to try to talk to that patient. It's always there working for you, talking to the new patients, giving them easy ways to reach out to your practice. And I think COVID has really led to an explosion in teledentistry. I know that it's, we're talking from 0.5% to 5%, but that's a huge shift. And patients recognize that the toothpaste is out of the tube. I believe that this is going to be an expectation for patients who are looking for large cases post-COVID. They are not going to just accept pick up the phone and call and come in no. I think that this is going to be an expectation. Why can't I send you photos and you tell me what that first visit is going to look like? And what they're really saying is, I want to be reassured that you guys aren't going to be shaming me and trying to rip me off.
Well, and I think one of the yes, and I think you kind of glossed past exactly how you use teledentistry as a tool to help the patient overcome their fears and concerns, really procedurally. And since I'm always presenting this to offices, I'll tell you how I talk to offices about it, where you provide a way for the patient to HIPAA compliantly be able to communicate back to the office not only a series of pictures that give the staff the ability to get a good idea of what's going on, but actually a description of the patient's complaint. And then a lot of what Operatory EDS focuses on is providing a way for the staff to have a game plan. And that's what you're talking about here, is having the patient give you enough information so that you have a game plan when you're talking to them. So you've got a description, you've got pictures that guided pictures that the patient can provide you. And again, this is the kind of comical line that I use in my demos all the time. I'm like, I know your practice doesn't do this, but every other dental practice I've ever talked to will occasionally have a patient text them a picture of what's going on with their teeth. Yeah. And I'm like, and it's a super handy technology, and I applaud you for using technology to advance dentistry. However, it's a colossal HIPAA violation every time you do it. And then one of the greatest things about that particular application that I love is that it integrates right back into the practice management system along with all the attachments. So you've got all this information attached to the patient's chart, and it makes it so much easier for you to communicate not only with the patient, but with the rest of the staff members. And so having an intelligent conversation with a game plan makes it a much more comfortable transition from that patient sitting at home in the chair and not knowing how to start and being able to walk through your front door.
Totally. Yes. And I like to say that 90% of everything is confidence, right? If you have the confidence, it's going to be, you're just going to have better results. Yep. And frankly, confidence to patients really translates to competence, even though that's not necessarily true. But that's what it, so it gives you and your team, particularly if you don't have the confidence in the case, the ability to build the confidence prior to having that conversation with the patient. It gives patients confidence in you because you're just giving them that ability to send in the photos shows that you care, that you're trying to give them that easy first step, right?
Yep.
And so, to find out more, go to operadds.com. We call this our virtual consultations that you can do easily, and it's very, very inexpensive. It's part of our lowest costly. It costs less than $100 a month. I mean, it's just really with a whole bunch of other stuff. So if you're not providing virtual consultations from your website, if you're not making it easy for these high value cases, these are the $25,000, $30,000, $50,000, $60,000 cases. So completely worthwhile. Plus, it has all your other paperless forms that you need, consent forms, everything else. So go to operatory.com. Thank you, sir.
Thank you, Bryan.